So good evening. My name is Jackie McLaughlin. I am the director of the Post-Baccalaureate Pre-Health Programs at the University of Pennsylvania. And I'm glad that you've decided to join us for this virtual information session this evening. I hope we have an opportunity to answer all your questions. I want to introduce two very important people to you who are going to help facilitate this information session for you. And that is Faye Patterson. Faye is the coordinator for our program. She does a lot of frontline advising for the students as well. Very important in helping people get their questions answered and getting you to the right person who can help you whenever you have a question or an issue. And we are also joined by Amy Mulhern. Amy is one of our enrollment specialists, and she functions as our wizard behind the curtain, if you will, in helping to make sure technically everything works well for our information session this evening. There are just a couple of housekeeping things that we probably should go over, and I'm going to ask you to keep your microphone on mute during this information session. And we definitely want you to get your questions answered. So the best way to do that is to put your questions into the Q&A session down at the bottom. If you forget and just inadvertently put it in the chat, we'll get to it in the chat as well. But it's a little bit easier to track everything if you go ahead and put it in the Q&A down at the bottom of the page. And Faye is going to put into the chat for you some important dates, such as our application deadlines and things like that. So, and at any point along the way, you can start putting your questions into the Q&A. I'm just going to give you a little brief introduction to our programs and what we do for pre-health students at the University of Pennsylvania. We have essentially two certificate granting programs for pre-health students at the University of Pennsylvania. The majority of our students are interested in going into medicine. So I would say probably about 95% of our students who come in every year are seeking application to medical school, and we would consider them pre-meds. The other students who are typically in our program are students who are looking to go to dental school, so our pre-dentals, or those who are interested in veterinary medicine. Our pre-vets. Occasionally, we have students who are also interested in advanced practice nursing or in PA, and we can help to support those students as well. And that's about, you know, the gamut of the health professions that people come to our program seeking. Sometimes students will be in the program and they'll change their mind sort of midway about what they want to do, and we'll sort of advise them and help them and support them in that direction if they determine that medicine, you know, isn't really the right course of action for them. So basically, I said we had two essential programs. Our primary program is called the Core program, and the Core program is designed for people who are true career changers. So that would be the student who majored in something that wasn't science, let's say an English major or an economics major, or an art history major. And you got your degree in that area. Maybe it was in your junior year or after graduation that you decided, you know, I had thought about medicine when I was younger and decided to go a different route because of other interests. And now I've come full circle and really find myself wanting to go into medicine or dental school or vet school. And this is my last chance. I'm going to throw my hat in the ring and I'm going to see how I do, if I can do it. So that's our typical course student, someone who does not have a science background and needs to do all of those prerequisite courses to be qualified to apply to professional school, health professional school. Our other certificate program is the specialized program for specialized science. And these are students who have studied sciences. Maybe they don't have the complete profile of prerequisite courses that they need, or maybe they didn't do as well as they wanted to in their GPA as an undergrad. And so now they're coming back to do additional coursework in advanced sciences so that they can strengthen their application. And when they apply to medical school or dental school or vet school, be the strongest applicant that they can be. So that really defines our two populations. And then we have a third group of students who fall in between. So a lot of people will find themselves, well, you know, I had bio and I had a chemistry course, but may not have had all the other prerequisites that they need. So they don't fit into the core program or into the specialized program, but they fall somewhere in between. So we're able to do an individualized plan of study for those students as well, so that they are able to fulfill their prerequisites and build a strong application to the school of their choice. It's important to know that this program is very structured. We are a comprehensive program. We have a lot of support in terms of advising. So it's not just the courses, but it's trained advisors in pre-health advising. We have a lot of comprehensive programming, such as assisting you with writing personal statements, experts who come in and assist you with interviewing skills and developing interviewing skills, preparation for your MCAT or other testing that's needed. We also have a variety of speaker series. So if you go to our website, you'll be able to see, I think, at least 2 recordings from speakers that we had come in this fall already. So we want to expose you to the field and people in the field so that, you know, you're growing in ways outside of class as well. We also have journal clubs. We have a very active student government organization who helps to coordinate activities for the students. We also have individual student interest groups, such as one very active group that we have right now is the American Women in Medicine group, which is a chapter of the professional organization for women in medicine. And they are very active in our program. They invite a lot of speakers and do a lot of activities. Right now with COVID, there are virtual activities, but as soon as we're able to be back on campus, they'll be doing things face-to-face again. We also have a health disparities and social justice interest group. And then there's another group of students that was mainly focused on doing service-related activities that is going to be partnering with that group when we're able to go back to live face-to-face, so that in terms of health disparities and social justice, there's going to be a variety of service activities related to that as well. We have had in the past very active, you know, Spanish and medicine group as well, and a couple of others that are listed on the website. So the student interest groups really come from the interests of the students in the student body, and working with me to create sort of a group. Well, how do we bring people together about this, and what other types of activities could we do? We also have podcasts that one of our students has started. It's called Pen Pals, and they're really fun and really interesting. So I believe that there are links to that on our website as well. So we have put a lot of time and support into during this time of COVID, when we are all social distancing, with trying to really sustain and keep a vital student community, so the students don't feel isolated while they're actually going through this academic program. It works successfully. It's a little more successful on some ends than others, but it's really good to see what, you know, students come up with. And the podcasts were one of the, I think, fun, creative things that came out of this time of COVID. So I'm hoping that all of you are staying safe. We had a very successful fall semester. We're looking forward to starting our spring semester in January. We have a small group of students who comes in January, so we'll be having 7 or 8 students join us at that time. And I guess those of you in the audience are looking ahead to either summer or the fall. So I think what I can do is maybe I should just open it up to questions right now. We'll take the first group of questions that are in the Q&A or in the chat. And then, you know, I can come back and talk a little bit more about the programs if you want me to do that. So Faye, which one I see that there's a lot of back and forth in the chat. Should I start with the Q&A or the chat?
Start with the Q&A, Jackie.
Okay. All right. Thanks. Okay. Yeah, wasn't following along what was going in there. So the first question that I'm seeing here is, are courses available to Post-Bac students the same offering as the undergraduate students? And if so, is there a risk of missing enrollment in a critical course? That's a really great question, Patrick, because, you know, it's an important question to ask when you're looking at different post-baccalaureate programs. Our courses are dedicated to pre-health students, to pre-health post-baccalaureate students. So when we roster courses, they're rostered under a different section number. And our students know when they're looking at, say, Biology 101, am I going to be enrolling in Biology 101 in a daytime section, or am I picking the correct LPS section? So as I said, we do have dedicated courses for the post-baccalaureate pre-health students, but all of our courses must be approved by the department. So our Biology 101 must be equivalent to the same Biology 101 that's being taught during the day, even though it's being offered in LPS and at a different time. So it's very important that the content of our courses be equivalent. There is no risk of missing an enrollment for a critical course. It's really important that you work with an advisor, though. So when you apply to the program and you're offered admission, we like to get you in early for your first advising session. And that's when your plan of study is planned with your advisor, and you know exactly what courses you're going to take. Sometimes for the specialized students, there might be an advanced course. It might be a 400 level seminar course that only allows 20 students in the class. Well, there might be 20 students ahead of you who are pre-health students who've already enrolled in that course, and there may not be a seat. So you can't necessarily always get the course you want because it may be full. However, we have a wide breadth of courses for you to choose from. So there again, working with your advisor to help to plan options for you, and knowing that, well, if I wasn't able to come in and get that course in the fall semester, then I'm going to be able to get that course in the spring. And what's the best way for me to go about that? So I think that's, I don't know if you're looking at the core or the specialized. So, you know, that question might be a little bit different depending on which program you're looking at, but hopefully that answers what you were looking for. The next question is there any financial assistance for military Pennsylvania National Guard veterans? You might look ahead at the Yellow Ribbon program. So if you're eligible for the Yellow Ribbon program, you can apply those benefits towards this program. And that's really about all that I know right now, but you could contact our Student Financial Services, and the Student Financial Services at University of Pennsylvania should be able to give you a little bit more information about that, because I don't know what your specific benefits might be. Because it is a certificate program and there's certificate granting, usually you would be eligible for those types of programs with military assistance. Okay, I'm going to take a sip of tea here. Okay, moving on. Antoinette, good evening, Antoinette. I see that you're currently deciding between medicine and dentistry. We have quite a few students. There's always somebody every year who's trying to decide between the two. Would I have to declare my career intentions before entering the program, or does the program allow for flexibility that would allow me to make this decision? I have to say that I think when you enter into our program, I still consider that you're in a process of discernment. So this might be your first step, or maybe you're re-entering this direction again because you might have changed your mind early and you're coming back to it. So the idea that you aren't sure if you want medicine or dentistry is not a problem. You can use that time that you're in the program to really follow your direction and continue to develop your interest in those areas, so that by the time you complete the program, obviously we want you to have a much better idea of which direction you want to follow. We've had students who've come in, wanted to go into medicine, and they've applied to dental school, and vice versa. And we also have had students who couldn't decide between veterinary medicine and human medicine as well. So it's always, it's a struggle. And sometimes it takes a lot of self-reflection to decide what's the right path. So there's no problem with that. What we're really designed to do is help to mentor you and help you to identify what that direction is that's going to be best for you. Okay. What is the number of students on average that are enrolled in your program? Our program, our whole program, counting the two certificate programs together, is about 250 students. We have been upwards as high as 300 students in the past. The specialized program is a little bit larger than the core program. Students are typically in different types of classes, so you may not really meet students who are in the other program, but that's where the student activities come in. You might be involved in a student interest group and meeting more students that are in the program and have greater exposure to the student network that way. Okay, there's an anonymous attendee here who wants to know how we evaluate students. So I'm going to guess that your question is, how do we evaluate students for admission? We're looking for someone who's highly motivated. We want to understand through your application what your intention is. We want to understand your academic background. We want to know how you arrived at this decision to apply to a post-baccalaureate pre-health program. If you struggled academically in the past, started down this direction and it didn't work out for you, we want to understand that. What happened? What were the roadblocks that you encountered? What were the challenges that you had along the way? Why is it different now? Very wholly academically, because medicine is a very, very difficult academic pathway to follow. So we want to be assured that if we can offer you admission to this program, that you have a chance to succeed in this program. Specifically, in terms of GPA, we do want to see a strong GPA, but people with lower, weaker GPAs are sometimes admitted as well. So it really depends on what the strengths are in your application. I think there was another question here. Can you still look at GRE scores that expire during the course of an application? Sure. Jackson, if you have GRE scores, you can submit your GRE scores, even if they are older. We like to see all your test scores. So if you have ACT, SAT, and GRE, we would like to see all of them, because all those test scores test different things in different ways. And if there's one thing we know, it's that if you're following a pathway in medicine, there's a lot of testing in your future. So this gives us sort of another snapshot of, areas where you might, have strengths. or weaknesses that need to be addressed while you're preparing for this pathway. So I hope that then answers that question. Next question is, are classes usually graded on a curve? And is the coursework factored into our undergraduate GPA when we apply to medical school? That's a really good question. One of the advantages to a program like University of Pennsylvania's program is that the classes you are taking while you're attending our program is they are all undergraduate courses. Why is that an advantage? Because when you apply, I'm going to use medical school as the example, but it's true for all the professional schools. When you apply to medical school, your undergraduate courses are listed and then totaled. And then under that will be your post-baccalaureate courses that you have, which would be courses in our program. And then schools can see what your science GPA is, non-science GPA, and so forth. And then they are totaled together. So taking, for someone who has a lower GPA, taking advanced undergraduate science courses can really result in increasing an applicant's GPA for medical school, which is one of the reasons why, you know, the program can really help someone turn that around. But when your application is viewed as part of the application process to medical school, they're able to see what you did as an undergrad separately as well. So, you know, they're able to get a picture of your maturity, you know, things like that have what the student that you are now, not just the student that you were when you were an undergrad, okay? That gives a better picture of oftentimes of a student's ability and preparedness for medical school. Hi there, Priya. Hi, how are you? How large are your admitted class sizes for the pre-med post-bac typically? All right, that's a good question too. We have different sizes depending on when you enter the program. So for our core students may apply for admission to the program in the summer or in the fall semester. And for the specialized program, students may apply to enter in the summer, in the fall, or in the spring. So as I just mentioned at the outset, we have about 7 or 8 students who are specialized students joining us in January. So that's the smallest group that we have. And we don't take course students at that time because the courses are sequential. Usually you have to take a first half and then a second half. And the way that we typically roster them is the first half in the fall and the second half in the spring. So the largest influx of students comes in the fall. And then second to that would be in the summer. So we might have around 50 students between the two programs coming in the summer and maybe 75 or 80 students coming in the fall. And that's across the two programs, core and specialized, okay? I'm gonna go out on a limb here and say it does not feel, it is a large program, but I do not think it feels like a very large program to the students in the program. They get a lot of individualized attention and the class size is not overwhelming. As I mentioned before, many of our specialized classes, the advanced classes, are limited at 20 students. The most you're going to see is about 35 or maybe in some of them 40 students in a class. Of course, there are TAs in those classes as well, and the faculty are very available. In the core classes, they are typically about 25 students in a class. Sometimes it can be a little bit larger, 30, 35 students. I was just looking at our enrollment for the spring and I saw that organic chemistry was pretty high. So I think he's up over, you know, closer to 45 or 50 students. But that's, you know, as I said, that's a little high for Orgo, but there is a lot of support in those classes as well. The next question is, since the program does rolling admission, when is it advisable to apply for the fall rather than just looking at the official deadline? Okay. I think you should apply to the program when you have all of your materials ready. We do have an early admission deadline, so if you're in a hurry to get an early decision back for the fall, you certainly would want to get your application in early. That early decision deadline is in February 15th. You'll know then early in the spring whether or not you've been admitted. But you're not in danger of not getting a seat. So I've never had an application cycle where I've had so many qualified applicants for the program that we had people we had to turn away. I've never been in that position. So that's not a risk of being turned away because I don't have room for you in the program. So it really depends on when you're ready to able to get your application in. I think earlier is better because you're able to plan around that, but it really depends on what things you need to take care of personally, okay? How many students are admitted to the specialized program? So again, it depends on what semester you're planning to enter. So we had 7 admitted, 7 or 8, I can't recall exactly, for January. Again, we would have maybe about 25 or 30 coming in this summer, and maybe about 50 coming in the fall. So that's just general. Those seats are not capped, that number of seats. So I can take fewer students than that. I can take more students than that. It really depends on how many qualified applicants we have. The way that I manage that sometimes is if I need additional sections of a course, sometimes I'll add some more courses into summer. If faculty are available to teach that, I found, years ago that we needed to expand some courses into offering them both in the fall and in the spring so that students had enough courses to choose from in the program. And there are an awful lot. We have a brand new course being offered this spring, which is great for specialized students. It's a Pathophysiology course. There are 30 students right now enrolled in that. So you have to take the physiology one before that. And then this is an advanced physiology course with a lot of clinical correlations. So I'm very excited to see how that's going to go for the students. We're also looking at developing a new course maybe for the next year or so on the human microbiome. So that would be a really cool course. So we'll see. When evaluating applicants, what are the key characteristics that you're looking for? Again, I'm looking for potential. I'm really looking to understand who you are and what your motivations are. And your potential to do well and excel in this environment. So this academic environment is very difficult. It's very challenging. I just spent most of my morning reviewing all the course evaluations from the fall. And it is true, students, will say in the course evaluation, this was very difficult. This was very challenging in ways that they hadn't maybe, had that level of academic rigor in the past, but they all, for the most part, were very positive about the experience, even given the fact that our courses have all had to transition to fully online education because of COVID. So obviously we're going to be planning to going back to our face-to-face courses when we're able to do that. But the idea that we've been able to successfully transition the courses at this point to fully online, I was really, really happy to read through those evaluations. So we're looking for characteristics, someone who's really academically motivated, maturity, that's a big one. And again, what's motivating you, and do you have the academic potential to succeed here. And then that will help you succeed beyond our program. So I hope that helps. If you have some more specific questions, certainly, put them in the Q&A and I'll try and address that. What's the acceptance rate into the specialized program? Okay, I haven't looked specifically at the admissions numbers for this past year, but I would say in general, our acceptance rate runs somewhere between I would say between 30 and 40%. So it varies a little bit depending on the application pool that we had, but that gives you a general idea. Okay, it is a competitive program. This next person wants to know, can students work full-time while attending the program? It depends on which program. For core students, our recommendation is no. It's next to impossible to work full-time and do the core program. The core program is really composed of a lot of lab sciences. They require a lot of additional time outside of class. It really is not possible. Students sometimes in the core can do a part-time job or a part-time volunteer position. We usually like students to not be working initially, maybe in the first semester, so that they can get acclimated to what the workload is academically. Now, when you go to the specialized program, which are different types of courses, they're the more advanced science courses. They, for the most part, do not have a laboratory component with it. We have many people who are working part-time and some even full-time with the program. Now, we have folks who start off maybe as a full-time student and then get a job at the University of Pennsylvania. And if the job is full-time, they can get benefits that help with tuition. So you're going to see a lot of combinations of people who are working for the university, and some will get some educational benefits for that if they are a full-time employee. But for the core program, because of the types of courses and the time demand outside of class, it is not advised to be working full-time in that program. Approximately how many students are accepted into both the core and specialized studies program? I think I went over that already. It depends on which semester it is. In the course of a year, it may be upwards of, it may be 125, 135 students total, somewhere in there. Some years it's 150. So it really, depends on how many qualified applicants we get to the program. And it looks like Faye's offering a question about the certificates and how long is the program? Great. And are we allowed to make it an informal post-bac and only take the necessary courses left? All right, so I'll try and interpret what I think you're asking me there. We have two different programs. All right, so when you're asking me how long is the program, there are different requirements for the core program than there are for the specialized program. The core program is completion of 12 course units. The specialized program is completion of 8 course units. Because the core program requires more credits or course units, it obviously takes longer than the other program, which could be done in a shorter period of time if you're doing it full-time. Our students are allowed to attend either full-time or part-time. So for a specialized student, they might be attending part-time, taking 2 courses a semester and doing it over the course of 4 semesters or maybe 2 years. That also can be done very easily in 2 semesters, taking 4 course units each semester if you're not working, and then do it very quickly. For the core, if you're interested in doing the core program in 1 year, you have to enter in the summer because it is a large amount of courses that need to be taken in that time period. So that gives you a summer, a fall, and a spring. That is typically reserved for approval after your application and offer of admission with me, because it's very, very hard to do and do successfully. So we want to make sure that students who are doing the core in a 1 year timeline are really setting themselves up for success with that. The majority of students go through the core over a 2 year timeline, meaning they have 2 years. Every student has 2 years to complete the program. When you start, whether you choose to do it on a full-time or part-time basis, we start you off with a 2 year, giving you a 2 year window. And you can decide if you're going to do that on a full-time or a part-time basis. So all of those things are really important discussions to have with your advising team about a timeline for you, what your expectations are. When you're invited to interview for the program, we address timeline with you, sort of what your expectations are, what you're looking for, what do you need to have in your program, and is that a realistic timeline for you? So then the question about whether or not you can make it an informal post-bac and only take necessary courses, well, you have to take, 8 CUs or 12 CUs, depending on which program you're in. Do people enter the program and not complete the program? Sometimes that happens. So we might have a situation where someone applied for medical school already. They haven't gotten a decision, and they want to apply to this program as sort of a plan B, just in case they don't get in. And then maybe they start the program in the fall and they take 4 courses, and then they're offered admission or they come off a wait list and they leave the program and they go to medical school. So we do have situations like that happen. But we do not admit people into the program and then say you can just do whatever you want, take whatever courses you want, or that you think are necessary if it's 2 or 3 courses. That's really not the appropriate program for you then. Penn does have a program that's a general post-bac program, and if you wanted to apply to LPS, to the general post-bac program, and just do an informal post-bac, you're certainly welcome to do that. So you can take a look at the website and see if maybe you only have, 2 or 3 courses to take. If that's a better fit for you, then definitely by all means take a look at that program. One thing to know though is that the post-bac pre-health students, the students in the pre-health program, have priority seating for the pre-health courses. So students may not always be able to get into a course that they want, into a pre-health course if that course is closed because the seats are full. Okay. What is the average GPA of students accepted, and do you weigh the science GPA? We definitely look at an overall GPA and we look at a science GPA. So for many of the course students, they might not even have a science GPA because what if they were that English major who didn't take any science courses as an undergraduate? Well, we definitely are looking at both. Maybe somebody had only 1 course, they took intro bio and didn't do well and then decided not to take any other sciences. Well, they might have a low science GPA because they didn't do well in that course. Maybe they got a C, but we take that into account. Well, why did they get a C? And that's just that whole GPA. Then a science GPA is based on a grade in 1 course. So, of course, we look at that differently. The average GPA of accepted students is over in the core. It's much higher than it is for the specialized students. So we look for strong GPAs in the core students. I think the average GPA is probably around a 3.6. average GPA for students in our program with the specialized and core students combined is around a 3.6 as well. For specialized students, they're students who've had science courses. They may not have done well in some of their science courses, so they're looking to strengthen that GPA. We look at both the overall GPA and that science GPA and want to see, if there's any disparity there and why is that there. We generally say that we want you to have a GPA of a 3.0 or above. But again, I look at all factors in the application, and we have accepted students who have GPAs below a 3.0. So if you fall into that sort of category, don't be afraid to submit your application if your GPA is below a 3.0, if you have other strengths, that you think are really going to help you to stand out or help us understand why your GPA is where it is, okay? We like to have that discussion with you. Can you comment on your dental school admission rate? I believe last year it was 100%. One year, maybe it was 2 years ago, it might have been 80% because one person who was applying to dental school didn't get in. But for the most part, it's almost always 100%. There's a handful of students, so it might be 5 students applying to dental school. So it's a small population. So when you talk about, the percentages, if one person doesn't get in and has to reapply a subsequent year, it looks like a big drop, but it really isn't. Our students do very well in dental school. Almost 100% of them get in. I can say the same thing for vet school. Almost 100% of those students get in. We have many more students applying to medical school, so it's a larger population, and obviously it is, the percentages are going to look a little bit different. For the core students, it's usually about 90% of them are offered admission, and I would say for the specialized students, it's usually about 83, 87, somewhere in there, percent of students are getting offers of admission. So they're doing very well. Students do very well. And that's really a feather in their cap because they are coming from a larger program. So, if our program was smaller and kept smaller, you might see that closer to 100%. But we do have a lot of applicants at one time. So we could have 90, students applying any given year. I think in this next cycle coming up, we'll probably have 65 or 70 students applying to med school. Okay. Is it common for students to do research at a lab while doing the program? Yes, it's very common. Not so much now during COVID. A lot of our students who were doing research in labs or doing research on different projects actually were fortunate enough to be able to continue doing research at home, working with data or other things, working from home. The university is slowly bringing people back into research programs. And one really good thing to know is that our post-baccalaureate pre-health students are categorized along with research assistants at the graduate level to be considered for re-entry during this time of COVID into research positions. That's not the same for regular undergrads. Okay, so you're in a category of students that is eligible to resume that type of work on campus as safety measures are put in place. So it's very common for students to be doing research across the university, and we encourage students to do that. And Emmanuel is asking us if we require research to get into the program for admission, or do we help students gain research experience while they're in the program? Well, Emmanuel, we don't require that you have research experience to apply to the program. We want to know if you do have research experience. So of course we ask about that, but it's not a requirement to enter the program. A lot of students may not have had the opportunity to have any research. So this might be the best opportunity for them to gain some sort of research before they make that application to medical school. We do help students to gain research experience, whether in the program we have connections with people who are looking to hire research assistants. We look for people, we have people who come to us looking for full-time or part-time people to be doing, work in their labs. And we also point students to other directories and resources that we have at Penn for finding research positions. So yes, we do try and help you develop that opportunity. I have never seen a student come through the program who by the end of the program was not able to find a research position. So it might not happen your first semester, but typically before you leave the program, you certainly will have opportunity to participate in research across campus. It's a very rich environment. Someone wants me to discuss linkage. Okay, if you take a look at the website, and I'm sure everybody has done this, I want you to, spend some time on the website. We think we've put a whole lot of information up there to really help you with your decision. But linkage basically is very similar to an early admission process. So the way that the application cycle works for medical schools is that you are applying a year in advance of your matriculation. It's a long year to wait. And that year in between, when you submit your application to medical school and when you actually start medical school, is called a glide year. Okay. What a linkage does is a linkage enables select students who meet certain academic criteria defined by our medical school partner to apply and matriculate within the same year. So it means that if you have to know in advance, oh, I want to apply for a linkage program with Perelman School of Medicine. So when you come into the program, you have to know that in advance. And in that very first, fall in the program is when you're going to be preparing yourself for applying to Perelman. And then you would matriculate when you complete the program in a year. So you can do your application to the Perelman's linkage in 1 year or 2 years. It's very highly competitive. So again, they set the criteria for what they're looking for in students, and the criteria for the different medical school, it's different for every medical school. We also do not accept people, for linkage typically who have taken the MCAT previously or who have, withdrawals on their transcript or, things like that. So we have some other additional rules. But if you're interested in linkage, we do have linkage to linkages for dental students as well. Vet schools do not have linkage. But if you're interested in linkage to medical school, that's something you want to talk about in your admission interview, if you're offered an interview, so that we can let you know if you might be lined up as a good candidate for one of the linkage programs that we have, so that you can explore that a little further. We have a new linkage this year with the College of Medicine of New Jersey Medical College. So I'm excited to see how that's going to work. We have several applicants for that. And hopefully that'll work out to be an official linkage going forward. And we actually have a student applying to University of Pennsylvania for a dental linkage this year. So that's kind of exciting to see that happen as well. I have to say that linkage is a small number. I would say maybe, 10% of our students or so. So, any given year, it's probably not more than 10 or maybe up to 15, students who are throwing their hat in the ring for a linkage spot. Most of our students are applying broadly. That just is the nature of what the fit is, for students and what the criteria are or what fits their lifestyle and timing. Okay. If we took a standardized test like the ACT more than once, do we submit all of them, the best one, or should we super score? When you submit your scores, typically you submit your scores through the testing site. If you're submitting test scores, like scanning it and submitting it yourself, most of your scores, if you've taken them previously, are all together on one report sheet. So if we're interested in super scoring, like somebody who has taken the SAT multiple times, we have seen people who've taken the SAT multiple times. I will look at a super score. I will do that. I'll look at individual scores and I'll look at a super score. I look at the time of when you took them, where you were, in your academic career when you took them. And then I also look at a super score and I also look at your grades, in comparison with all those things. ACT, I like to see it all. So I like to see, did you retake it? How did you do when you retook the test? And certainly, I'll look at a super score. So I like to look at scores every which way that I can. So if you've taken standardized tests, I'd like to see the whole picture. And that really helps. I like to see somebody who did really poorly and then did really well, somebody who has variability in their test score. We like to look at that and understand that. So they're all things that are important to understand about for you to understand about your application, and then things that you want to know about how you can prepare for your next application, like your application to professional school. So that's all very important information about you as an applicant. Are there a set number of years after undergraduate graduation that an applicant with a science background would be considered a career changer? I've heard classes can expire at some point. Okay, I understand. All right, let me have a sip of tea. Typically, if your science coursework is 5 or 6 years old, you want to think about whether or not you're going to be retaking all those courses again. What I would suggest you do is sort of in where you are at this point in time, think about, a school that you're interested in applying to and just call their admissions office and ask what they recommend. For some people in that situation, they might want to repeat the biologies and the chemistries, but not necessarily have to repeat the physics. So it really depends how far out you are, what you've been doing. For some people who've been out of school and maybe working in a scientific field, they may not have to repeat some things. They might be able to go on with advanced coursework. So there's a lot of individual things that we want to consider in that application. We'll look at it very closely. And again, that's something that we'll talk about in an admissions interview. So sometimes classes do expire. Sometimes we do expect people to repeat courses. Some people want to repeat courses because of grades that they received that they weren't happy with. So we talk about all those things that pertain to your application in an admissions interview. And that's the best way for you to get really good advice about, what your plan will look like and what you should do. Okay. Raul has a question here about, is the program appropriate for career changers? Yes, absolutely. The core program is designed for career changers. I'm out of school for several years now. My test scores and grades are old. Is this a disadvantage? No. Your test scores are just giving us a snapshot of how you did on that test at that point in time. Your grades may be old, that's fine. We have people in the program who've been out of school for 1 or 2 years, and then people who've been out of school working in a field, for quite a few years. If this is something you want to do, you've got to stick your toe in the water and see if you're going to be able to do it. It's not held against you if your test scores and your grades are old. We want to know what you've been doing. We want to know how you arrived at the decision that you think that you want to throw your hat in the ring for applying to medical school or dental school or vet school. But I think that if this is a dream that you have, then let's see if we can help you get there. That's how I look at it. So if you get accepted to the program, go through the program, your grades will no longer be old. And your test scores won't be old either. So you'll be in good position to do what it is you want to do. Madeline has a question here about how flexible is the program if a student would have to leave for a semester, such as military training. That's been a challenging one. We had a student who did have to leave for military training in the middle of courses. That was really difficult for her because she had a gap in between. But it's something to have a discussion about. It might be better to wait until you do your military training and then come back and then do the coursework. It's really important to understand how much you can do and accomplish before you'd have to leave for training. So all those things. I have to say, I think that our program is as flexible as we can be in terms of trying to individualize the program for you. We have set criteria we need to fulfill in the program, but we really want you to be able to be successful. So, it's important for us to have a conversation. If you have other obligations, let us know and let's figure out what's the best course of action for you. Okay. Let's see. Okay, how are Post-Bac students integrated at Upenn, seeing as they come from a unique and diverse cohort? That's a really good question. I think that you are your own group of students. You're not in classes with undergrads. You're not in classes with graduate students. You're in classes with each other. So in terms of integrated at the University of Pennsylvania, I'm not sure at which way. I mean, there's a very vital community among the pre-health students and activities that are planned. As I said, it's a comprehensive program, services designed specifically for you. But in things like going to the gym, using the library, other resources like that at Penn, I mean, you're like any other student. Those resources are available to you. But there's lots of activities and parts of the program that are only available to pre-health students. So you're going through this program with your own set of peers. Okay. I'm afraid that we're running out of time, so I'm going to ask maybe or answer 1 or 2 more questions, and then we're going to have to say good night for the night. Does the program offer any specific volunteering opportunities to post-bac pre-health students, and how have these been impacted by COVID? We have a lot of partnerships that bring students into service-related or volunteer activities. Yes, during COVID, especially in the beginning, a lot of these were shut down. Some have opened up now. So just like the Academic Associates program, we have pre-health students who are actually in the emergency rooms and participating in recruiting patients for studies and being able to shadow in those settings. But it took a couple of months to safely roll those opportunities back out. So this has been, things were really limited during COVID, and they are still limited at this point, but they are starting to open up very safely. So we have students who are in clinical settings, every day at this point. And this will be the last question that we have time for. Can a strong academic record in graduate school compensate for a weaker record? If you had a weak undergrad record and a strong graduate school record, we'll take that into account, and we'll be intrigued by that. So we'll want to understand why your undergraduate record was so poor, and we'll take a look at the graduate record, and if you did well in that situation, and I can think of, a situation, more than one, where we've, decided to take a chance on a student and give them an opportunity to see if they could excel. And so, yeah, we're not going to rule somebody out just because you had a weak undergraduate record. So we're looking to see whether or not you might be able to succeed, to be able to provide an opportunity for you. And we're at a little bit after 6, so we've been here in an hour. I just want to say thank you very much to all of you who came. I hope that I was able to get to your questions. If you still have questions, Faye will put our contact information in the chat so that you know how to reach out to us. Please do follow up, and we will be very happy to answer any remaining questions that you have. Again, I read every application that comes into the program, and I really look forward to seeing your application in there as well, and hoping that you're successful with your future endeavors. So again, thanks very much, and have a good night.